President Donald Trump recently signed an executive order that aims to revamp care for kidney disease, so more people whose kidneys are failing can have a chance at early transplants or home dialysis. These changes won't happen overnight because some of the initiatives require new government regulations. But advocates are saying this is an important development for a lot of folks who have to live with chronic kidney disease. A lot of us know those people. For now, we are joined by Timothy Callahan. He's a healthcare policy researcher at the Texas A&M Health Science Center. So Dr. Callahan, can you lay out some of the key points for us about this executive order, how specifically it addresses care for kidney disease?
Yeah, so this executive order is designed to do a few different things, 4 in total. The first thing this executive order is trying to do is to increase public awareness about kidney disease. Many people who have kidney disease don't even know that they have it.
Really?
Really. So one of the things this executive order is trying to do is to increase public awareness so people know to go get treatment and we can prevent some of that end-stage renal disease that needs dialysis.
Cool.
The second thing the executive order is trying to do is to move dialysis from dialysis centers, which are all over the country, into people's homes, because research tells us that people who get dialysis in their home typically have better outcomes and better lives. So the federal government's trying to move dialysis into people's homes, even though most of it's happening in those centers where it's less effective.
Got it.
The third thing the executive order is trying to do is to make it easier for people to donate kidneys. Currently, insurance will cover you donating a kidney, but won't necessarily cover those ancillary costs like childcare or lost wages. So the federal government wants to make it easier for people to donate to increase the supply of kidneys. And then the last thing this executive order is trying to do is to make it easier for researchers to develop an artificial kidney. So researchers have been working on this across the globe for the past few years, but the goal is to spur that innovation to make that change happen quicker so that when you get end-stage kidney disease, you're not waiting on a donor, you can get an artificial kidney instead.
An artificial kidney? How close are we to that?
I don't think we know for sure. There's some research teams across the globe that think they're close, but the question is it going to be an outerwear device? Is it going to be internal? And they're still trying to work all that out, and then it has to go through all sorts of steps of federal approval. Yeah.
Going back to getting more dialysis care in homes, so better outcomes for these patients. But how can the federal government, from what I understand, a lot of these folks who provide dialysis are private companies. So how does the federal government encourage more in-home dialysis? How does that work policy-wise?
So the federal government pays an incredible amount of money for dialysis because of the way the federal statute's written. The federal government's spending about $115 billion a year just on dialysis. So the federal government changes the funding priorities for those companies and says, we're going to pay you less if it's in the center and more in the home. Those companies will innovate to make sure that they're capturing that extra money.
Okay, fascinating. And so looking more into an artificial kidney as well. Okay, I don't know if there's any precedent for a sort of sweeping executive order on a healthcare policy, but based on what you're seeing from this and what you know from studying policies like this in the past, can this help? Can this really do something?
I think that the fact that the advocacy groups are excited about this is a good sign. I don't think anything will change overnight. The advocacy campaign is probably going to happen fastest, the awareness campaign, but some of these things will take quite a bit of time to develop. But the fact that this is something that a lot of people suffer from kidney disease, it's going to be a very popular idea. I think we will see some progress. It's just a matter of fighting against those small number of companies that are determined to keep the dialysis in centers.
Understood. Timothy Callahan from the Texas A&M Health Science Center. He's a healthcare policy researcher, among other things, but this is the expertise we sure like to pump out of him. So thank you so much.
Thank you.